About 6 months ago, I thought that I'd pulled my groin. It was on the inner part of my thigh and sort of where my hip flexes, and lifting up my right leg was just very, very painful. Over the course of 6 months, I tried every self-treatment I could think of. I went for inactivity and rest for weeks at a time. I tried all the different NSAIDs, non-steroidal anti-inflammatory drugs, things like Tylenol or acetaminophen, ibuprofen, aspirin, even Voltaren, which is a topical NSAID. The functional ingredient there is diclofenac. So I would typically try one of those NSAIDs for like a week, see if it had any effect, and then discontinue use. None of those had a long-term beneficial effect. I also tried deep tissue massage, I tried stretching, icing. So each of these things I tried multiple times, often for a week at a time, over the course of the last 6 months. Nothing was making it better, it was only getting worse. Activity of almost any kind was making it worse, whether that was volleyball or biking or running or hiking. Anything where I was using my legs or on my feet just seemed to make it worse. And it got so bad that I was unable to sleep at night because every time I would straighten my leg, it would just be excruciating pain all through my hip, my inner thigh, all the way down to the inner side of my knee. It didn't matter whether I was sitting or laying down, but if my right leg was bent and I straightened it even a slight amount, it was just shooting pain, so excruciating. And so in the middle of the night, if I were to shift my leg and straighten it the littlest bit, that pain would wake me up and I would not be able to go back to sleep. Based on some injuries I've had in the past, I know that if I'm not able to self-treat, then it's usually something serious and probably something mechanical, either a torn ligament or, in this case, it turned out to be arthritis. So I made an appointment with an orthopedic surgeon who specializes in hips and went in and had them do x-rays of both my hips just because I was concerned. There is some family history. Some of my aunts and uncles and my father have had hip problems and hip replacements, and so I wanted to make sure that I understood, where my hips were, what their state was, and where I might have problems. So even if the right hip is the one that was bothering me, I wanted to make sure that the left hip didn't also need attention, and just to understand, if nothing else, that it is in okay shape. So my 6 months of self-treatment attempts started in April of this year, and then I decided to see the orthopedic surgeon in October. Before I went to see the surgeon, I had rested my leg for about 4 days, but then I played 2 hours of volleyball that morning. I went to the doctor's appointment, and honestly, I think because I'd rested for so long, I downplayed the pain, I downplayed the symptoms, and gave the doctor probably a more positive impression of my condition than was realistic. I went home that night and I couldn't sleep at night because of the pain from having played volleyball that morning. And that really is the key factor for me. I can handle the pain during the day, but at night, if it wakes me up and I'm not unable to get a good night's sleep, even if I'm taking sleep aids, over-the-counter sleep aids like diphenhydramine or doxylamine succinate, that's Unisom, I can't do that on a continued basis. I have to at least be able to get a decent night's sleep most nights. Basically, the understanding I came away with is, yes, you have arthritis in your right hip, and basically at this point it is pain management until such time that you need to have your hip replaced. So 3 days after the doctor's visit, I had been in pain. I got a hold of the on-call doctor at the practice and was telling him that I had probably downplayed the symptoms and was in a lot of pain. He prescribed me an oral NSAID, which was diclofenac, and he also prescribed me a sleep aid, trazodone. So I tried both of those for a few days, but honestly, they were not really helping. 5 days later, I had contacted my original doctor through the electronic portal, and he prescribed me a different non-steroidal anti-inflammatory drug, which was meloxicam, also known as Mobic, and told me to discontinue the diclofenac. So I tried the meloxicam and have been using that every day since. That's been about 3 weeks, and the meloxicam has helped. One day after the meloxicam prescription, again, because of the pain I was in, I asked the doctor for a steroid injection in my hip, And so he performed that using ultrasound to do a guided injection directly into the hip. I guess the hip is pretty deep and it's difficult to get an injection to the actual area that needs it. So he did that. The steroid goes in with an anesthetic, so you get immediate relief to the hip joint, but that wears out. And then you see what the effects of the steroid injection actually are. And those seem like they could vary a lot. The doctor told me that the positive effects could last anywhere from a couple weeks to several months, but he also cautioned me that you can only have 3 of those injections per year. I'm going to be going to Peru in a few weeks to hike the Inca Trail, and I just wanted to make sure that my understanding was correct and that I was okay to do this. I talked to the doctor and basically said as long as I can handle the pain, then there's nothing wrong with doing the Inca Trail. In fact, staying active is a good thing. While you're trying to manage and live with the pain, it's best for your joints, even if they are painful, to have motion and activity that keeps blood flowing, that keeps them mobile. So it's this sort of weird two-edged sword. You want to be active, you want to be mobile. That's healthy for the joints and healthy for your body in general. But you have to do that and balance it with the pain that's going to come along with that activity. 12 days after the first appointment with my doctor, I scheduled an appointment with a new surgeon who is in network for our insurance provider. Unfortunately, my original doctor is not in network, and because it seemed like surgery was going to be in the cards for me at some point, I felt like I needed to find someone in network. Fortunately, I know some people who have had hip replacements in the past, and one of those guys recommended a doctor to me who just happened to be in network. I've now met with him, very impressed with him, and think he'll do a great job. I met with the new doctor to discuss the timing of hip replacement because I was kind of thinking that it's definitely in the cards for me and trying to figure out what the best timing would be. The winter months are definitely the months when I have less opportunity for outdoor activities like hiking and volleyball. So that would be my preference. So the new surgeon and I talked about dates. We have a wedding the second week of January, so we were looking at the third week of January. Unfortunately, all his surgery slots were already taken that week of January, and that's because a lot of people are looking at their insurance deductibles and when their plan years start and end, and they're trying to get the surgery in to optimize the use of their insurance. So I did tentatively schedule surgery for January 23rd. My surgeon is not entirely sure that I should have surgery done at this time. There seems to be a balance between having the surgery done and persevering with the pain until a later date and then having the surgery. In the past, it was thought that the hip replacement hardware would only last about 10 or 15 years, but there have been more recent studies and it looks like these can last 20 to 30 years without any replacement or adjustments being made. So I'm almost 55. If I can get 20 years of continued activity and use, I would prefer that because that will put me at 75 years old. I don't know how active I'll be at 75. I don't know if I'll even be alive at 75. God willing, I will be, but who knows? So I think that getting a hip replacement now is a good idea. One of the considerations that the doctor shared with me has to do with the timing. He himself has had both his hips replaced, so it was great to talk to a surgeon who has done the procedure, dealt with hundreds of patients, and then also undergone the surgery himself. He did the surgery on his 2 hips at different stages of development. What he explained to me is that the first stage is the inflammatory stage, when you still have cartilage but it's damaged and you've got bone growth rubbing against that and causing continued damage. Evidently, this causes a lot of inflammation to the joint, and that spreads throughout that part of the body. The second stage of arthritis is bone on bone. So that's when all the cartilage is gone and the bones are just rubbing against each other. It's still painful because the bones have nerves in them. But what he explained to me is that if you have a hip replacement done when it's bone on bone growth, immediately after the surgery, you will feel better. And the recovery appears to be fairly quick. Whereas if you have it done earlier during the inflammatory stage, because you're already inflamed, the surgery can cause a lot more inflammation and the recovery time can be much longer. He himself experienced this. So now I'm trying to figure out what the right time is for me to do the surgery. I think the right answer is to do it soon because it is affecting my sleep. I've always struggled with getting enough sleep, and this is just making it that much harder. So I think that the right answer is to have surgery sooner rather than later. It's a weird situation because, on the one hand, you're in pain, but they don't tell you to really stop your activities. There might be certain activities you should stop. For example, the doctor did tell me to halt any high impact activities such as running, so I'm not going to run anymore. But that to me is not a big loss. He seemed to be okay with my sand volleyball. If that was indoor volleyball, I'm quite sure he would not have been okay with it because that would be very high impact. Thankfully, the sand is very forgiving, and I don't jump all that much, so I think it's a reasonable activity, and he didn't seem bothered by it. I sent my original doctor a written summary of where I thought I was and just trying to capture the situation and make sure that I understood it correctly. So what I wrote him was, here's how I would summarize my situation. Please let me know if this sounds about right. And I said, I can remain active and manage hip pain through continuous use of meloxicam and periodic use of sleep aids and other nonsteroidal anti-inflammatory drugs to aid sleep. Currently, meloxicam at 15 milligrams is making pain and discomfort bearable, but pain still affects my sleep, i.e. it hurts when I shift in the night, though less than before meloxicam. So sleep quality may suffer periodically. Activity level will be somewhat reduced. My gait, etc. will be off, which will cause my body to shift and adjust to accommodate, which can cause negative ripple effects. I can remain fit until the pain is no longer manageable, at which time surgery would become necessary to remain active. The doctor responded that he thought that was about right. So it's up to me to decide when the pain is no longer manageable. I wanted to touch briefly on the emotional well-being of patients who have been diagnosed with hip arthritis. I admit to having felt some depression. I would not classify it as severe, but it's not a good feeling to find out that your body is breaking down. And throughout most of my life, most of my injuries have been soft tissue injuries, so sprains or pulled muscles or knots or things that I was able to self-treat or with help from a physical therapist get through. This is not something I can do that with. It is, I think, real and natural to feel some depression when you're undergoing something like this. But if you're feeling that, to a large extent, you probably need to seek some help. I do kind of feel like my body's betraying me. So at any rate, I'm having to accept that pain is a part of the aging process. And so at this point, I just need to accept my limitations. I need to accept the pain that I'm going through, although I know that I can have the surgery and make it better with some intent and perseverance. So accept and persevere is kind of the state I'm at right now. I try to dispel those depressing thoughts whenever they pop into my head and just focus on the positive and focus on making the situation better. I hope this vlog entry was helpful. And if you have any questions, please feel free to post them in the comments. And if you like this video and want to find out when I post additional vlog entries, please subscribe. Thanks for watching, and remember, in the game of life, play to win.